When dialysis was considered an investment with a very poor ROI and patient survival on dialysis being extremely poor was the norm. It was in this backdrop that a bunch of enterprising nephrologists, Jatin Kothari, Vishwanath Billa, Srirang Bichu and Rajesh Kumar, banded together to find a solution to this problem. Having trained in premier institutes in India and overseas, and having observed the quality of dialysis services provided in the global north, they recognized the need for a change in the existing status quo in dialysis within India. Apex Kidney Care was born out of this need and commenced operations on a wing and a prayer on Independence Day 2008 with 3 centers out of Mumbai. With an emphasis on quality and objective to improve patient survival and provide dialysis patients with a first-class service and experience, it wasn't long before AKC made its presence noticed in this healthcare segment. The standard of care delivered had such an impact that it quickly translated into growth for the company. As the number of centers grew, AKC focused on improving patient convenience and vitalizing its own revenue model, bringing several services that these patients depended upon under a comprehensive in-house umbrella. The Apex Pharmacy Outlets is one of these, which dispenses prescription drugs to all these patients. The Kidney Care Lab is another one with multiple collection centers servicing all the diagnostic needs of dialysis patients across the country. An Advanced Vascular Access Center, which is a turnkey service for vascular access, which is the Achilles heel for all dialysis patients. With nephrologists driving this company, clinical research and data assimilation has always been at the core of AKC's values. We've built Access, an ultra-comprehensive kidney disease electronic health records that captures every aspect of patients' health, diagnostics, therapies, and outcomes. Armed with a database of close to 250,000 renal patients, AKC has driven research with numerous publications and citations. The Apex Water Manual has become a reference manual on managing RO plants and water in dialysis centers across the country. Analysis of Access data illustrates that dialysis patient survival in India under AKC is no less than that from the global north. Data analytics have also helped existing dialysis patients in the state of Madhya Pradesh to be redistributed to closer centers and reducing their travel distance to the center from 56 to 31 kilometers. The first white paper on dialysis was released in 2023 and AKC has played a leadership role in its creation. Apex Kidney Care's treatments have added quality and years to so many patients on dialysis. We have touched the lives of tens of thousands of human beings in our 15-year journey, and occasionally even those of animals. The achievements of our patients are a testimony to the philosophy on which Apex Kidney Care was conceived. The best part of our journey has been our privilege to write our story one chapter at a time. This story has become the story of dialysis care in India.